Very good morning. It's Breakfast with Keith Dalton in for Kev Lawrence today. And I was intrigued to hear on the news that Peterborough is one of the highest rates of COVID day on day. And I thought, well, we need to find out exactly what is going on and confirm. Emmeline Watkins, Deputy Director of Public Health, joins me on the line. Hello, Emmeline.
Hello.
Now, is this true, first of all? Are we one of the highest in the country?
Yes, we are. Over the last week or so, COVID levels in Peterborough have been the highest they've ever been, and we've been in the top areas in England for COVID cases. And approximately at the moment in the east of England, about 1 in 25 people have COVID currently.
1 in 25. So, I mean, is this mostly Omicron as opposed to Delta?
Yes, across the whole of England now it's nearly all Omicron.
Right. I mean, this is probably not something you can answer, but Omicron is supposedly milder than Delta, and yet it's the dominant force now. How does that happen?
Yeah, so Omicron is milder, which the good news of that means that we do have fewer people in hospital than if it had been Delta. So, on the other hand, the vaccine has different levels of effectiveness against infection. It's still very effective against hospital outcomes. And it's also slightly more transmissible. So it's a milder, slightly more infectious disease. So we still need to keep all of those precautions going because people still do have to self-isolate if they get it, which just impacts public services and builders and businesses. So we still do need to keep all of those cautious behaviours going.
And from what information that you have on the situation, if we're very high in this area, is there a reason for it? Can you put your finger on any sort of reason for it?
Yeah, there's a few things. Peterborough often has had slightly higher levels. Some of the things that we put in place, so when Plan B came in and the recommendation for people to work at home, that's actually less possible for people in Peterborough. A lot of their work are key worker positions. They're unable to work from home. So some of those interventions have slightly less impact in Peterborough. And the other thing we do know is, like the rest of the country, actually, we have had quite a lot of cases in children and young people as the return to school happened. So that's sort of some of the reasons why we're seeing such high case levels.
And have we got higher or lower vaccination rates than perhaps the rest of the country?
Yes, unfortunately, Peterborough does have a lower vaccination level than the rest of the country. It's about 10% below what the rest of the country's at. And it is really important that people do still go and get their vaccine, either their booster vaccine or if you haven't had your first, to go and get that first dose of the vaccine and have the discussions with people that would give you the confidence to go and get that first dose.
And we still have the walk-in centres available if people want to go.
We do still have the walk-in centres available, and you can find those online at Vaccinators on Tour. We'll give you all of the places that you can go and get the vaccine.
OK, so apart from going and get vaccinated if we haven't been, is there anything else that we can still do that doesn't make life too uncomfortable for us? Because we have to sort of balance it, don't we?
Yes, absolutely. So I think it is just keeping these cautious behaviours. So taking a rapid test before you meet groups of people that you don't normally meet, wearing a face covering in crowded spaces, keeping your distance or meeting outside if you can, and all of those sorts of the routines that we've got into with COVID. It is really still important those going, especially over the next few weeks.
Well, I sincerely hope that we won't be talking for this forever, Emmeline, but thank you for the time being on the subject, and I hope everybody listens to those wise words and tries to help each other, really. That's what it's all about, isn't it?
Yes, trying to help ourselves to get back to a sort of more normal way of life. But thank you for having me on.
That's okay, Emmeline. Thank you very much indeed.